Recording in progress. Recording stopped. Recording in progress.
Hello, everyone. Thank you for joining us for today's webinar. My name is Donna Chow, and I will be your host and your moderator for today's eLotus webinar. Here at eLotus, we have been holding educational courses for over 2 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of continuing education. So today we have 3 groups joining us. Our first group is our Watch It Free group, who use the code to get free access for today's webinar. The video replay and CEUs are not available for you, but you can upgrade to our second group, our paid group. Paid attendees will be able to enjoy today's webinar, watch it as many times as they want for the next month, and earn CEUs. And finally, our third group. If you want to upgrade to the ultimate and full access, you can join our third group, which is our Gold Pass members. I'll go into more detail later today, but our Gold Pass members have access to live webinars and distant learning courses for the duration of their membership. Today's webinar is Acupuncture for Chakra Imbalances, focusing on IBS, presented by our new speaker, Jen Kwan. We've had a number of classes on treating digestive disorders, but none where the speaker combines his knowledge of yoga with TCM. Before we begin, I'd like to go over a few items to familiarize you with our webinars and how they work. Today's webinar will be from 11 a.m. to 1 p.m., and we will have one short break in between. For lecture notes, download them from the Blue Course Access page in your eLotus account. To use the webinar chat room, set your chat preference to everyone so that everyone can see what you're typing and be part of the conversation. To ask a speaker a question, enter your question into the Q&A box. And if time allows, the speaker will respond to them. And finally, the quiz and the video replay. You will be notified by email tomorrow afternoon once they are available. All right, so without further ado, allow me to introduce you to Jen Kwan, who was born and raised in a place where Chinese medicine is deeply ingrained in the culture and way of life. He has seen his family members use acupuncture and Chinese herbal medicine for healing and wellness since he was a child. Dr. Kwan has over 15 years of clinical expertise and has helped many people with a variety of diseases, including infertility, insomnia, allergy, migraine, headache, emotional disorders, hypertension, addictions, obesity, PMS, pain syndromes, IBS, and others. Okay, Jane, you can go ahead and take over and share your PowerPoint now.
Thank you, Donna. Hi, everyone. Let me get to the screen. So can everyone see the slide? Yes, right?
Dr. Kwan, not yet. I think you haven't shared the PowerPoint yet.
Okay, let me double check to share the screen. How about now?
We see it now.
Okay, wonderful. Hi, I'm Jen Kwan, and I'm a chiropractor and acupuncturist. It's truly an honor to be here to share about some clinical experience and how to treat IBS from different approach. And that's what we are talking about today, focusing on the chakra imbalances. How do we harmonize it and balance that to help to reduce the IBS syndrome or cure. So here's my contact information. I had my education in California, and I had a chiropractic and acupuncture degree there, and I'm having my practice now in New Jersey. Here's my website and the email address. If you want to contact us, please feel free to do that. All right. So IBS is part of the issue that's in digestive system. So we're going to talk about the importance of digestive system first. Here I have a paragraph from 黄帝内经, Yellow Emperor's Canon of Inner Medicine. So if you can speak Chinese and if you can read Chinese, that's great. I remember one of the speakers the other day, he's a Caucasian and he was speaking great Chinese and he was reading the classical Chinese we call Wenyan, which is amazing. So here it is. Let me minimize the screen here a little bit. So 黄帝内经 says 人死生先成精，精成而脑髓生，骨为干，脉为营，筋为刚，肉为强，皮肤坚而毛发长，骨入于胃，脉道于通，血气乃行。So the slide you have is actually a translation from Google. So it's a Google translation. And I have been working on it. I have some reference from another book, this one. And it has different translations. So I have combined both of them. So basically it's saying in the beginning of human life, that the essence of life is formed first. Then it develops into the brain and the spinal cord, and finally, the human body is shaped. The bones are used as branches and pillars. The blood vessels are used to transfer qi and blood, so the whole body is nourished and maintained. Sinews and tendons connect with bones and make it strong. Muscles as the wall to protect bones, organs, tendons, and vessels. So when the skin is firm, the hair is attached and grow, the 5 grains enter the stomach and the vessel channels through the whole body, where the blood and qi travel through them continuously and endlessly. So here's talking about the importance of digestive system. So once the body is developed to have the life going, the 5 grains will enter the stomach and the qi and blood will be able to flow through and nourish the body to keep the life going. All right, so here's another slide that is emphasizing the importance of digestive system. Spleen and stomach are the foundation of post-heaven qi. So it's the training that we have from day 1, the foundation of theory 102 or 101. Says according to Chinese medicine, the spleen together with the stomach is called the root of post-heaven qi and essence, as opposed to the pre-heaven qi and essence produced by kidneys. So post-heaven qi and essence is acquired via food and drink and various forms of stimulation. So that's why we have a profession as acupuncturists. We can stimulate certain acupuncture points to help the body to produce qi and blood, for example, stomach 36. And also, post-heaven qi can be acquired through exercise, like Tai Chi, Qigong. And if you are a breatharian, then you don't really need to do this. You can just breathe through the air. So that's why some practitioners, they can meditate and that they can get the post-heaven qi. Spleen and stomach transform food into nutrients, which are the sources of qi and blood. Qi and blood are both vital to life. Qi enacts functions, and blood furnish nourishment to all organs and tissues of the body. So stomach governs to the downward function, so to push the chyme into the small intestine. Spleen governs uprising function, which signify the motility, secretory, assimilative, absorptive, and dispersing functions of upper digestive tract, among which gut hormones and functional activities of vegetative nerve system, which is autonomic nerve systems of the gut, will be involved. So continually we'll be talking about how illness can be developed. And here is saying 百病皆有脾胃衰. So if there's any dysfunction of spleen and stomach, it can lead to other illness. So dysfunction of uprising and down bearing function of spleen, stomach can cause gastrointestinal disturbances and various spleen deficiency syndrome. Furthermore, they may also affect the functions of other organs and cause other illnesses. So we all know the importance of digestive system, spleen, stomach in Chinese medicine. For example, if spleen qi is deficient, then there might be damp phlegm developed, and that can affect lung. It can cause lung qi deficiency or phlegm in the lung that can cause cough or shortness of breath. And if spleen qi is deficient, it might overconsume kidney qi, and then that can cause kidney deficiency. And if it's kidney insufficiency, there might be lower back pain or impotence or urinary issues. Then if spleen qi is deficient, it can cause qi stagnation. That can also cause liver qi stagnation, and then liver fire, liver yin deficiency, liver yang rising, and then internal wind. So those are just some examples. I'm saying dysfunction of spleen, stomach can lead to other illness. But if you translate the Chinese sentence there, it's actually saying if there's dysfunction of spleen, stomach, it can lead to all illnesses. Talking about the diagnostic methods. Let me change the screen here because I'm seeing that bar on top. All right. So in Chinese medicine, we all know we have 望闻问切, observation, auscultation, and olfaction, interrogation, and palpation. Actually, that would be the last one, 望闻问切. So it says, 有诸行于内，必行于外. So whatever is happening interiorly, it might manifest outside in the body, in the appearance. So when it comes to digestive condition, spleen, stomach, here we can, if we can look at the nose, if the nose is red and there are acne or pimples, that could be indication of stomach fire or spleen, stomach, damp heat. And if the facial complexion is pale, then we know it can be spleen qi deficiency. If we look at the body shape, then if the person has a big belly, usually there might be stomach cold. And so the body's mechanism is to have lots of fat there to warm up the middle jaw. So that's how we can have a good idea how the patient's doing from observation. And then auscultation and olfaction. We can tell from the person's voice. If it's weak, then there might be Qi deficiency. And then based on the smell, sometimes we can tell if, for example, diabetes patients, usually there's some kind of a smell. In the beginning, could be sweet fragrance or smell, and then later on there might be bad apple smell, if you know that. Okay, interrogation. Interrogation is a good way to get more information from the patients. If you ask how's the bowel movement and what's the stool look like, usually it will give you a good indication how the person is doing. Usually with IBS, frequently there might be loose stool or the urge to go to the bathroom after they eat. And the shape of the stool actually will give us a good indication. For example, if the stool is firm and it's like a pebble-like or ball, it could be yangming fire. You know, there's fire in the large intestine. And there are many ways to help that. Basically, eliminate the heat in the colon, and can also take some herbs like Renchangwan or Chenqi Tang. Now, if there is indigested food, there might be stomach cold, as we mentioned earlier, then it's obviously we need to warm the stomach, eliminate the cold at the same time. Now, if there's diarrhea, usually it's a combination of yang deficiency and stomach deficiency. If the stool in the beginning is hard and firm and then later on is soft, then usually it's indicating there is stomach cold, but the colon is doing okay. So all these are examples that we can find out from interrogation. And then pulse taking and palpation. If you have taken many training or seminar classes here, you master the pulse taking, then it's going to be a piece of cake for you to find out how the patient is doing. Otherwise, you know, from other diagnostic methods, you can find out how the patient is doing. I would like to share two cases from in the process of making diagnosis. It's very important because sometimes we might think the patient is not having a serious condition based on the description from patients, but we have to be assertive and make good judgment. For example, I remember one patient came in and he was saying he was having morning diarrhea, and usually what comes to our mind would be kidney yang deficiency, and that's the morning diarrhea or 5 o'clock diarrhea. And usually we go along, come up with a treatment plan, just want to tonify the yang. However, it's very important to make sure we gather all the information to make sure there's no other serious underlying condition. And this case that I'm sharing is that he was talking about morning diarrhea or a daybreak diarrhea, and then we found out actually he had colon cancer. So if I just focus on tonify the yang, then it wouldn't be good. Another case I want to share with you is the importance of palpation. Another gentleman came in and he was complaining about having abdominal pain, and I palpated, and there was rock-like sensation when I palpate the abdomen, and so I recommend him to get checked up, and found out that he actually had stomach cancer. So that's why it's very important that we do a thorough job in making diagnosis so we can be sure patients are getting proper care. Here's a very interesting question for you. So, will you be able to survive without a stomach? Actually, I have this Chinese sentence here. It's saying, 有胃气则生，无胃气则亡. It's saying, if there is stomach qi, then there is life. And if there is no stomach qi, then there's death. 胃强则强，胃弱则弱. If the stomach or digestive system, digestive system is strong and is doing well, then the person is strong, there will be strength. If the digestive system is weak, then the person is going to be weak. If there is stomach, there's life. If there's no stomach, then there's death. When I read that, it's very straightforward. And actually, I was just thinking and do more research, because nowadays, with modern technology, actually medical technology and all that, actually, I found a story, David Fogel, and I give you the link there. Actually, so to let you know what's happening with David was that he witnessed his aunt went through a horrible time when she had cancer. So he started to get some checkup and found out he had a gene that he might have the cancer. So to avoid going through those challenging situation or time that he could be having, so he decided to have her stomach removed. And then basically with a procedure, they connect the esophagus to the small intestine, and he's able to continue his life like that. But so certainly it's interesting to know without stomach nowadays, with special procedure, the person is able to continue his life. So here, another paragraph is basically saying the importance of having a healthy lifestyle, especially the food that we choose. So we need to educate the patients that to have a healthy lifestyle, having good sleep and eat good food, exercise and all that, and also get alternative like the treatments that we're offering, acupuncture, therapeutic massage, and breathing exercise like Qigong, Tai Chi, pranayama. All those will help to keep our digestive system in a good condition. Then there will be longevity. Now getting to this slide that talks about IBS, irritable bowel syndrome, also known as spastic colon or mucus colitis. It is the best known as functional gastrointestinal disorder. It is characterized by absence of detectable organic disease plus symptoms of dysfunction in any part of the gastrointestinal tract, including the oropharynx, esophagus, stomach, small and large intestine, anorectal or biliary tract. It is a motility disorder involving the small intestine and large intestine, with variable degrees of abdominal pain, cramping, constipation, diarrhea. Abdominal pain, constipation, diarrhea will be the primary symptoms patients come in with. It's primarily, for a lot of people, it's more a reaction to stress in life. So those people who are more prone to get nervous, or some patients with anxiety, IBS might be a condition they will be having. Other accompanying symptoms can be bloating, flatulence, nausea, or a passage of mucus. Actually, a lot of people might have experienced IBS symptoms or syndrome. It is estimated that a minimum of 1/3 of the adult population has been experienced functional gastrointestinal syndrome. So with an international prevalence of IBS as high as 10 to 20%, and environmental etiology has been proposed due to a higher incidence in social, economically disadvantaged groups. In addition, women tend to report IBS-related symptoms more frequently than men. Could be that women are more sensitive and more honest about their feelings or what's going on in their body, because in clinical experience, it is true that we have less guys come in to complain about their digestive system, or how they are doing with the bowel movement or having abdominal pain. But clinically, we do see more women coming for those conditions. A lot of time would be constipation, diarrhea, or abdominal pain. Etiology and causes. So far, it is idiopathic. In Western medicine, there's no true answer why some people might be having IBS. And possible causing factors could be muscle contractions in the intestine, or it could be nervous system, severe infection, or stress. And then it could be change in gut microbiome. Here is breaking down of all those possibilities. So the walls of intestines are lined with layers of muscles that contract as they move food through the digestive tract. Contractions that are stronger and last longer than normal then can cause gas, bloating, and diarrhea. Weak intestinal contractions can slow food passage and lead to hard, dry stools. Nervous system can, if there is abnormalities in the nerve, in the digestive system, can cause you to experience greater than normal discomfort than when your abdomen stretches from gas or stool. So poorly coordinated signals between the brain and the intestine can cause your body to overact to changes that normally occur in the digestive process. So that will cause pain, diarrhea, or constipation. Some disease like Parkinson's disease, diabetes, or alcoholism can certainly cause nerve system issue, and then that can cause IBS. Then we'll talk about when someone has severe infection. IBS can develop after a severe bout of diarrhea. So gastroenteritis caused by bacteria or a virus. IBS might also be associated with a surplus of bacteria in the intestine. So basically, it's bacterial overgrowth. Stress can be another cause. And also, if there's a change in the gut microbiome, then that can also cause IBS. Primary symptoms of IBS. Primarily, there will be abdominal pain, diarrhea, constipation, as we have mentioned. Then if we want to have a good idea what can be the cause, if there's distending, migrating abdominal pain that is difficult to localize and is relieved by passing flatus, suggests a pathogenesis of chi stagnation. If emotional stress aggravates the pain, increases bowel movements or diarrhea, and pain is alleviated after bowel movements, a diagnosis of liver chi stagnation overacting on the spleen is established. Abdominal pain results from liver hyperactivity, then it could be liver fire and excess pathogenesis, blood stasis in the stomach can also cause abdominal pain. Obviously, insufficient spleen stomach cold, or external cold invade the digestive system can also cause pain. So diarrhea, constipation will occur after that. Triggers for IBS. Symptoms of IBS can be triggered by food. So certain foods can cause some people to have IBS syndrome. For some people, it might be nuts, some people might be fruits or dairy products. Sometimes could be carbonated drinks. All those, there's a possibility that those food can cause the symptoms for some people. And usually we do ask what kind of food can cause the symptoms, and we educate the patients what food they should eat, what not to. Clinically speaking, a lot of time I notice in this country that a lot of people, because the lifestyle, they eat cold or refrigerated drinks or icy water, cold food, usually are not helping them. So, and dairy is another big one. So a lot of time after we educate patients to stay away from refrigerated or icy drinks, ice cream, that kind of food, and a lot of time they do see improvement in their digestion. All right, so stress. This is very straightforward, basically, as we mentioned in the beginning. Some people are more prone to get nervous or anxious, and that can affect their digestive functions. Now we're getting to the TCM part, how TCM define IBS. And TCM is categorized as 泻痛, basically it's painful diarrhea. If there is abdominal distension, then it is 腹胀, or bloatiness, and constipation would be 便秘. Internal damage by the 7 emotion, unregulated eating and drinking, unregulated rest and stirring, and then or other procedures or wrong treatments or procedures can also cause IBS. Emotional disorder is another big cause for that. A lot of time people with depression or anxiety or bipolar disorder, all those that kind of emotional disorder, they usually have some sort of digestive issue, and IBS could be a condition that would be having. So the modern Chinese medical literature is unanimous in saying that the root cause of IBS is usually disharmony between the liver and spleen due to emotional stress and frustration. The liver may become depressed and qi become stagnant. Qi stagnation then results in abdominal distension and pain due to worry, lack of exercise, over fatigue, improper diet, or over or prolonged use of antibiotic. We all know that antibiotic basically kill all the bacteria, the good and bad ones. So that is something that we usually check with patients to make sure they're not overtaking antibiotics. Frequently, we'll tell them if it's not necessary, try natural options through food therapy or herbal therapy, so they don't depend on those medications. Spleen qi deficiency can result in fatigue, lack of strength, and downward diarrhea. So when to see a specialist? If there's weight loss, diarrhea at night, rectal bleeding, those are all warning signs that there is something serious going on, especially diarrhea at night. Weight loss is a warning sign that be some underlying medical conditions going on. Bleeding could be ulcer, stomach ulcer, or it could be colon condition, as we mentioned earlier. Actually, the gentleman that I mentioned about the morning diarrhea, that bleeding is the indicating sign that he had actually had colon issue. So after checkup, he was able to find out actually there was a cancer going on, and to get proper treatment. Iron deficiency and anemia, then certainly there's poor digestion going on. If there's unexplained vomiting or difficulty swallowing or persistent pain that isn't relieved by passing gas or a bowel movement, then it's time to see a specialist and to find out what's going on. In TCM, there are 4 patterns that can cause IBS. So qi stagnation, overacting on spleen, or a combination of cold and heat, stomach and intestine fluid deficiency, spleen and stomach qi deficiency. All those are the patterns that we have seen in the clinic. Progression of pattern. So it starts with liver qi stagnation and then overacting on the spleen at the initial stage that is causing the IBS, and then unresolved would overact on earth can be complicated by cold, heat, or flame dampness. A pattern of disharmony of the liver and spleen with a combination of cold and heat is manifested. Long-standing or liver qi stagnation turning into heat may further injure the yin and exhaust the fluid, progressing into a pattern of stomach and intestine fluid deficiency. And then a constitutionally deficient spleen and stomach and secondary spleen deficiency due to liver qi overacting, leading to a pattern of spleen and stomach deficiency. Chronic spleen deficiency, as we mentioned earlier, it can involve the kidney because overconsume the kidney qi and then can lead to spleen and kidney deficiency pattern. Now we have more detailed information for each pattern. So here's the symptoms that the patient might be having if there is liver qi stagnation, overacting on spleen, emotional stress, elicits symptoms of abdominal distension and pain, and then borborygmus and diarrhea. Pain is relieved by bowel movements. Secondary symptoms include distension and fullness in the gastrium and abdomen, belching, poor appetite. So these are the symptoms that is very common when someone has liver qi stagnation. Then if we look at the tongue, usually there's red edges and with thin coating and wiry pulse. Then the treatment plan would be soothe the liver, support the spleen. The formula that can be used would be here, Tongxie Yao Fang. Here's the ingredients, and usually you can get it easily from those providers, vendors. Now for acupuncture, here are the points that can be considered based on the conditions and the manifestations they're having. Stomach 36, stomach 25. For diarrhea, we'll be talking about based on different conditions. I don't know. I'm just gonna have feedback from you guys. If you see if you use moxa at your practice. Let me see. Actually, there's some question there. Okay. All right. So I remember when I first started my career, because the facility didn't allow me to use moxa. So a lot of time I wanted to, but I couldn't use. But later on, I discovered how moxa can be effective in helping patients for certain conditions. And we'll talk about that. Ideally, you can provide moxa treatments. If you can, that's really helpful and more effective for you to treat some IBS syndrome. So obviously, here are the points we talked about. For if there's diarrhea and if there's deficiency going on, actually moxa will be ideal rather than just doing acupuncture, cold, damp, and we can moxa to warm up the middle jiao, Ren 12, Ren 6. And to eliminate dead heat, we can use stomach 44, spleen 9, and for retention, inner 18. For stagnation, you can treat with a backsu point or a fromu point or a liver points. Kidney deficiency, then run 4, do 4, UB 23, kidney 3. So moxa will be also ideal for kidney deficiency. You can do that on run 4 and 6 and UB 23 or do 4. So here's a list of points that you can use for constipation, UB 25, stomach 25, and kidney 6, Actually, that one is Sanjiao 6. So Sanjiao 6 can be used there. Heat. If there's heat, then we eliminate the heat by using the points Li4, Li11. If there's stagnation, we can use REN 12. Liver 3, gym blood deficiency, UB20, UB21, stomach 36. So cold, again, here we can use Moxa for that, for those points, REN 8 or REN 6. Later on, we'll have a few cases, then I'll talk further more about how Moxa can actually help a lot of conditions that patients are having. If there's a combination of cold and heat, so that is the second pattern that we mentioned earlier. So distension and pain in the abdomen, and borborygmus, diarrhea with sensation of incomplete defecation or alternating diarrhea. Actually, incomplete defecation sometimes can be caused by lung qi deficiency. We'll talk about that. And alternating diarrhea and constipation, distension, and fullness in the epigastrium and abdomen, poor appetite and dry mouth, red tongue with greasy coating and wiry, slippery pulse. So the treatment plan for this condition, this pattern, will be harmonizing the stomach and intestine. You can consider using this formula, and it's called Umei 1. It has the ingredients listed here. For acupuncture points, similar points that we can use for diarrhea, stomach 36, stomach 25. And if there's cold, we can warm the yang through REN 6, the C of energy, C of qi, and REN 12 from a point of the stomach. Damp heat, eliminate the damp, and you can use Spleen 9, and the heat can be eliminated by using stomach 44. If there's food retention, again, an 18, and then liver qi stagnation. You can use the points to soothe the liver 3, 2, or a backsuit point of the liver, UB18. REN 4 do 4, and UB23, kidney 3 can be used to tonify the kidney. So this combination of cold and heat. Now, if there's a pattern which is stomach and intestine fluid deficiency, usually the presentation will be having dry stool, decreased frequency of bowel movements, and straining to defecate, abdominal distension and fullness, and detectable rod-like abdominal prominence in severe cases. So that's how palpation comes along. If you palpate the patient's abdomen, you would notice there's a rod-like abdominal prominence. A lot of times it could be on the descending colon, most frequently, and sometimes it's in the ascending colon area. And you can certainly feel that rod-like abdominal prominence when you do palpation. And there will be thirst because there's fluid deficiency, and there might be headache, irritability. And if you look at the tongue, frequently there's red tongue with scanty or dry coating, and the pulse could be wiry or tight. Nourish the yin, moisten the intestines, and unblock the bowel will be the treatment plan. And you can use 针叶汤 or Mazlan one. Those two formulas can help to moisten the intestine and nourish the yin, increase the yin energy, helping the body to have more fluid, especially for stomach yin and the intestine. Acupuncture points for this, because it's talking about nourishing the yin, we can use a lot of kidney points or spleen 3, kidney 3, those points to tonify kidney yin. And you can also use back su point for a spleen UB20 and UB23. If there's heat, we eliminate the heat by using 411, liver 2, stomach 44, Sanjiao 5, or GB43. Now, for a spleen and stomach deficiency pattern, so this is commonly seen when the patient is complaining about loose stool or diarrhea containing undigested food, poor appetite, focal distension in the epigastrium, especially after meals, increased bowel movements due to improper diet, dull epigastric and abdominal pain, and lassitude and weakness. A lot of time, people with this kind of pattern, frequently they will also have urge to go to the bathroom after they eat, because spleen deficiency is not able to hold. So that's another common symptom that patients might tell you. They have frequent bowel movements, and especially after they eat. Pale tongue with white coating and weak pulse could be the manifestation. So obviously the treatment plan would be to strengthen the spleen and tonify the qi. Sending by Zhu San is a good formula for that. And acupuncture points to strengthen the spleen and stomach, we can consider those points we have mentioned, and then just primarily focus on tonify the stomach and spleen. We can use the primary points or the back su points. And here we recommend you use spleen 3, stomach 36, and tonify the kidney at the same time, kidney 3, all that can help. Li10 is so Sandi basically is another point that you can consider for tonifying the spleen and stomach. Okay, so before we get to introduce you to another system that you can consider using clinically, I was informed that we will take a break before next hour. So we will take a break, and when we come back, we'll introduce you another approach that you can take to treat IBS. Okay? If there's any question, then
Recording stopped.
okay.